Hello. We had been talking about communication strategies in the last sessions. We were saying that every time we were saying that how the conversation can go ahead, see that the conversation doesn't break, and what communication strategies are to be used by the listener, the speaker, and help each other to continue the conversation. Today, I'm going to talk about the role of the family in getting conversation enhanced and what role the family can play. What can the family do to help the child to continue conversation and control the frustration on both levels, at the listener and the speaker's level, and control the breakdown of the conversation. So let's see what the family can do. Family includes parents, immediate family, extended family, all people around who are talking to the child, the teenager. So there are 4 types of strategies which the family can use. The first is clear speech strategies. Second is anticipatory strategies. Third is repair strategies. And fourth is expectation strategies. Let's go into these details, starting with clear speech strategies. What I mean to say is that the family members, when talking to the teenager, should be talking very clearly, accurately, slowly. Every word and sentence should be said very clearly and not very fast and in a mumbling mode of communication. This will help the child to understand what you are saying and will be able to continue the conversation. When we are talking about clear speech strategies, the family can use 2 main strategies in that. One is that when they are talking, they should, when they are giving especially the opinion, they should start the word with "I think." When anybody says "I think," the child would know that this is not a fact. This is their opinion, their thought, and the child will start expecting the same language. The second strategy is when the family member wants to change the topic, they should say, "Now I want to talk about something." For example, the family is discussing the birthday party they are having today, and some family member says, "Now I want to talk about the coming Christmas party." So then everybody knows that the shift has come, and the child would know that the vocabulary now will be related to Christmas and not birthday. So expectation will be set. This will help to prepare to think of the words in that respect. Second is when we are talking about clear speech strategies, the child can also ask the family, if the family members are not saying it clearly, the child can ask the family, "Please, can you speak clearly? What do you mean by that? I could not understand." And help the family members to retrace what they said. Coming to expectation strategies, pre-expected strategies. In that, what you can do is that the family members should prepare the child, especially the parents, should prepare the child for the coming conversation. For example, if the child is going to the class, then you expect the child and help the child to go through the lesson, read it once, and understand the vocabulary before the child goes to the class. So the child is prepared. When the teacher talks, they can understand. The same way, what else can be done? When you are expecting parents are expecting people for party at home, dinner at home. If it is a birthday party, and then the parents should talk to the child before the guests arrive, talking to the child about the names of the guests, the relation of the guests, the purpose of the gathering, what are they going to talk about, and what vocabulary is expected to be used, what questions are expected to be used. For example, if you go to a birthday party, someone's birthday is happy birthday, wish you all the best. So how old are you? What do you plan to do next? What do you want to become? So all this vocabulary will be related and the child will be prepared for answering that and leading into conversation. The same way when you are, suppose you are taking the child for a movie, then show the trailer first to the child. So the child knows the whole movie is about what is the concept, what is the theme, what is the story. So the child can understand the movie better when the child sees the movie. The same way, we are talking about repair strategies, which is the third one. Repair strategies means how to help the child to understand the conversation properly. So there are many repair strategies. For example, changing the environment. So the family has to be conscious that the child cannot listen and understand when there is a background noise. So that family members should move to the quieter area and talk to the child. If the member is not moving, then the child can request for that. My cochlear implant doesn't help me to understand when there is a noise, so I request you, let's move on to a quieter area. So that is the strategy the child will use. But the family member should be clear that when they are talking to the child, there shouldn't be a background noise. The same way, the family members should be knowing that when they are speaking to the child, they don't have to do any exaggeration of the mouth. For example, give me the mobile. They don't have to do that. They have to talk at a normal level. At normal level means at normal volume and normal speed, the way you talk to other people generally. So the family members should be trained to speak naturally and normally to the child, but not from a far distance, not more than 2 meter distance, because the child cannot still understand from a far distance. The family members are also taught that when they are talking to the child, they should be careful that they are not speaking too loud, not speaking too soft, not speaking too slow, not speaking too fast, not breaking the sentence into words, and talking naturally and normally. Also, they should be told that when the child cannot listen and the child asks for repetition, while repeating the sentence, they can rephrase the sentence. They don't have to exactly repeat the sentence because the child may not again understand if you repeat. So they have to learn to say it in a different way, in a different manner, using different words, rephrasing it differently. Because the child might tell the family member, say it in another way, I did not understand what you said. Also, the child should be able to ask that, did you mean 7 p.m.? Suppose the family member says, we are going for the reception in the evening, we have to be there by 7 p.m. And the child missed that 7 p.m., the last word. So the child says, did you say 7 p.m.? Or did you say 6 p.m.? And the family member can say, no, I didn't say 6 p.m., I said 7 p.m. You have to be there by 7 p.m. So this is clarification. And if the child has not understood, the family member can ask, what did you hear? What time did I say? What time you think you should be there? So this will ensure that the child has heard it well and can understand it better. Another thing they have to learn is in repair strategies that when a family member is talking to the child, they should not be moving around too much they should be stationary, sitting at one place or standing at one place and talking to the child, preferably facing the child and looking at the child. Because if anyone is using a new word which the child does not know, the child might need lip reading, and to look at the face will help the child to get the new word. So therefore, these are the repair strategies. Again, when we are talking about repair strategies, the family members have to learn to speak in short, simple sentences. Rather than long sentences, break the complex and compound sentence into short, simple sentences. Also, take more pause and wait after every sentence to give the time to the child to listen, process, and then react. Another thing they have to know is that whenever you are changing the topic, they have to say, I want to talk about this. Another thing, the family members have to do repair strategy when they're sitting in a group and talking to other people, and now anybody wants to address the child, they can draw his or her attention first and then say it. For example, you can say, Kritika, I wanted to ask you, did you like the movie yesterday? So then she knows that it is addressed to me, and the moment you take the name, the child is giving full attention to you, concentrating on listening what you are saying. So what else we can do? The family role is also getting attention and describe. The family members also should learn to repeat the sentence, but little slowly this time, so that the child can understand if the child has not understood for the first time. Now, the parents have to train the family for all these repair strategies in a way they like. And ultimately, the parents, the family, the teacher, the siblings, everybody helps the child to understand spoken language communication and help the child to extend the conversation and understand the conversation. So talk to your family members. Tell your child, if family member is not following that, the child has to use the repair strategy and give the request to the person. Also see that wherever they are talking, there are not much echo and reverberation, so they can change the seating. When you go with your friends or family members are going to a restaurant to have some meals, in that case, first ask the child, where would you like to sit? So the child has to call the waiter and explain that where he or she would like to sit. So give preference to the child first. So try these strategies, try talking to your family, try talking to your teenager and see how it works. And if you have any question or any doubt or it doesn't work, please write in the comments and I will get back to you. Thank you.